Innovation, imagination, wonder. These are just some of the words used to describe Dr. Harvey Passes. Dr. Passes explores interesting people and ideas that will stimulate you. He questions the people who develop, create, and employ novel concepts in business and everyday lives. He especially loves to speak with successful people. How did they do it? How can you do it too? So let's join Dr. Harvey Passes in his quest of wonder and curiosity as we watch Dr. Harvey Passes Presents.
I thought it would be a lot of fun to have a different kind of show today. I didn't invite any guests down, nobody to ask questions to. I thought it might be interesting, just you and I, to have a little bit of information exchange here. Actually, it's going to be me providing some information to you. And I thought it would be interesting, just kind of sit back and relax and have a conversation and to go deeply into a subject that has been a passionate part of my practice and dentistry today for years. And that is, well, technologically advanced dentistry and how people can finally remove the fear of going to the dentist once and for all, and when they're finished, how they get a smile makeover. A lot of dentistry has been focusing on this for the past 20 years. Obviously, you know that cosmetic dentistry is a big deal. Everywhere you look, you see cosmetic dentistry this, I'm a cosmetic dentist, and I've practiced this and I've practiced that. Well, I figured it would be very interesting today, since I'm doing this close to 34 years now, to bring to you two interesting things today. We're going to talk about how the fear is finally gone, how we do it. A lot of dentists have been providing the service over the years. I developed this technique that you're going to see back in, I would say, around the early 80s. And it's called the Dental Anxiety Control Program. Fascinating program. And we'll discuss that in a moment. And then after that, you're going to get a chance to see how an individual can transform his mouth to have a beautiful smile, the smile of his dreams, and how it can be done simply, easily, quickly in just 2 visits. And this is what's going on in dentistry today. It's exciting, it's what's happening, and it's great. So let's begin. Here's how we do this. First, there are a lot of people who are frightened about going to the dentist. Did you know that the government, well, the American Dental Association especially, states that about 1 of every 2 people in the United States has some kind of fear in going to the dentist, and that they just don't go to the dentist in any year. So what do we do about this? And what is the biggest fear in going to the dentist? The biggest fear in going to the dentist is the sight and sound of the drill, you know, the zzz, that sound. And the other is getting a dental injection, the needle. A lot of people don't want to see that injection. They don't want to know about it. And you know what? I understand that. That's a valid point. So there was a way I came up with in the early 80s. I've had training in general anesthesia. And when I used to put my patients to sleep, I noticed something very interesting. We would do all the dentistry. They'd be sedated for a few hours. And then, lo and behold, you wake them up. And when they come out of the sedation and their teeth are all cared for, they go home. And you don't see them for another 3, 4, 5 years. And they don't come back for routine care. They don't come back for even a hygiene visit. What do? They avoid going to the dentist until something hurts. They have an infection, a swelling, a broken tooth, all because they neglected getting a hygiene visit, which you should get once every 3 months to every 6 months. Very important that you do that. So in the meantime, this poor individual is still afraid of the dentist, comes back, and we got to do all that work all over again. Now, that does not make me feel pretty good, frankly, because I don't feel that I've been successful if all of my hard work gets destroyed because of someone's fear. I realize putting them to sleep is not the way to go, in my opinion. The way to go is to get rid of the fear once and for all. Want to know how we do it? Here's how we do it. Fascinating. I developed a technique years ago, and this technique was a 6-part program. And the 6-part program uses different things, which you're going to see in a few moments. You're going to see a few moments how a patient went through this program and got over her fear in going to the dentist. You'll watch it, then afterwards we'll discuss it a little bit, and then I'll take you on to something else. And then I'll explain how we're able to take all of that 6-part program and just condense it down into 1, maybe 2 visits. And it works perfectly in the great majority of patients. So, right now, I'm going to ask you to sit back, relax, and watch the dental anxiety control program being done on a patient who is very fearful in going to the dentist. It's only about 2 to 3 minutes. You'll find it interesting. So let's roll the videotape and let's see what's going. The Dental Anxiety Control Program is a 5-visit behavioral training process designed to diminish or remove the fear of dental treatment. The first visit enables the dentist to listen to the patient's objections to treatment as an empathetic partner. This patient is afraid of the dental needle and the sight and sound of the drill. She states that her previous dentist had treated her disrespectfully by dismissing her fears as childish and irrelevant. The dentist validates her feelings and explains that you cannot be tense while your muscles are relaxed. The program shows how to maintain muscular relaxation during tension from the needle of the drill. Through progressive relaxation and biofeedback, the patient learns how to master the art of relaxation. Progressive relaxation is a learned skill which instructs the patient to relax their muscles beginning with their eyes and working their way down to their feet. The session is tape recorded and then given to the patient who practices this twice a day for 1 week. A week later, the patient demonstrates this new skill. A small biofeedback unit is shown to the patient. 2 straps are wrapped around 2 fingers. The pores of her skin respond to tension by opening and then closing during relaxation. The biofeedback unit picks up these changes and feeds back to the patient when these changes occur in the form of a high-pitched sound during tension and a lower pitch during relaxation. The patient demonstrates progressive relaxation while the biofeedback unit is attached. The unit is given to her to practice with for 1 week. The patient returns and demonstrates her ability to relax with the biofeedback unit. The patient will now learn to use this skill while confronting the dental needle and drill. She assembles the syringe while using the biofeedback unit. She also holds the drill while it is turned on. All this time, she maintains control over her muscles through her mind. She continues to practice with the biofeedback unit at home during the next week. This visit, she will have an injection and then have a tooth polished with the drill while using this new skill. Upon conclusion, she states how much more relaxed and accepting she is to treatment. And, in fact, she states that she is eager to begin treatment. A positive attitude in achieving good oral health. The patient is now ready to help herself. So now you had an opportunity to see this program. It's a behavioral approach. An individual can't be tense and relaxed at the same time. And if you give the individual the confidence to be able to provide for themselves relaxation in the face of adversity, perceived adversity, then they have greater control over themselves, and it works great. And there are so many dentists using this procedure around the country. It's just a fabulous way for people to help themselves. And now what we're able to do today is to take that program, which is a 6-part program, and we're able to condense it by giving the patient a lot more time. Instead of having shorter visits where you come in for maybe a half hour and go over this entire program and then wait a week in between, we'll give the patient maybe 90 minutes or even 2 hours that first visit. And during that time, something very interesting happens. We develop what I like to call BLT. No, not bacon, lettuce, and tomato. BLT equals R. That's the formula. First, the patient begins to believe you. Then, L, they like you. Then from the B and the L goes to T. They trust you. And then the BLT equals R. They respect you. And when you have all of that together, you now have good rapport between the doctor and the patient. And it works absolutely well. I'll tell you, it's a terrific, terrific concept. And as long as we have time to work with the patient winds up becoming the big winner in them being able to get the smile of their dreams. Speaking about the smile of their dreams, let's talk about a smile makeover. Now you've gotten over the fear of going to the dentist. Now what are you going to do with this newfound skill that you have in being able to help yourself? Sure, you go to work, maybe you're in sales, maybe you're a teacher, who knows, maybe you're even a dentist, and you go ahead and you smile and you talk, but you don't like the way your teeth are positioned, you're not happy with that smile. Dentists hear this all the time, and dentists are aware of the difficulties that exist with all this. But what do? Well, maybe you don't have the time to be able to get the smile of your dreams. Maybe it takes a long time. Let me tell you the way it used to be done years ago. Years ago, it would take a long time. It would take maybe 5 to maybe 8 weeks to get a beautiful smile. How was it accomplished? You'd come in, you'd get an injection, then we would do surgery to sculpt your gums, to shape it the way you need it so that the gums are symmetrical with each other in the mouth. They look beautiful. Then you got to wait about maybe 5 weeks for the healing and the shrinkage to occur, stitches, antibiotics, pain medication. Doesn't sound too pretty, does it? Well, I must tell you, today, dentistry can do things a lot better for you. What we can do is this. Around 1991, I developed a laser, the clinical applications of a laser called the Homeomyag laser. And in working with different companies, and I helped to found the American Academy of Laser Dentistry, we came up with a technique where we could use a laser to sculpt the gum and give you the beautiful symmetry that you want. And then that same visit, we can then prepare the teeth and have you come back the next day if you wanted, or you wait a week, which is typically done. But you could have it done the very next day where there's no bleeding, virtually no pain, virtually no swelling, and then we could lay the porcelain on top of your teeth and bond it on with a laser, and you wind up with a beautiful smile and go about your business feeling a sense of confidence. Having a good smile is not basically just having beautiful teeth. Having a beautiful smile gives you the confidence to be able to meet the public and do what you want. So we're going to show you right now a gentleman who is in sales and wanted to have a beautiful smile. And we're going to show you how he was able to get the smile of his dreams in just 2 visits. And most dentists can do this today, and it works beautifully. So let's get a chance to roll the videotape and see how you can get a beautiful smile makeover in just 2 visits. Here we go. Now, what you have over here is a gentleman. We got a close-up of what he looked like before. And you could see he was not happy with those white patches, and he's got chips around the edges of his teeth, and they're a little bit off. One tooth is twisted and turned a little bit. He wanted things to look somewhat better. So now we're going to use porcelain veneers, and here's how we prepare the teeth to get it on there. First, we take the drill, and the man is numb. He can't feel anything at all. And I'll tell you later how we did that. We make guide cuts in the teeth. We go down about 1/2 millimeter. And we do that on the edge, only about 1/2 millimeter or so to maybe 1 millimeter. And then we take a pencil and we mark where those cuts are. So I now know I can't go further in the tooth than where those cuts are. Now you see me reducing the rest of the teeth down to where the pencil marking is. Now that I've finished, I go to the edges, do the same thing. So all in all, we're only taking off about 1/2 to maybe 1 millimeter in various areas of the teeth. Then when he walks out, we give him transitional teeth. There he is. Now, the teeth were prepared underneath. These are plastic type teeth that he wears for about a week or even 1 day. You wouldn't even see anything was done. Now we get after we've taken our impression, we send it to the lab, and now we're going to put the porcelain on his teeth. We're painting on his teeth a little liquid. It's an adhesive. Then we take the laser-like light and shine it on the tooth, and it fuses to the tooth. Now, we've got a resinous material that goes on the surface of the teeth, and this resinous material is going to stick to the tooth. Now there, take a look. See, that's the porcelain. The porcelain goes right on the teeth, and now I'm affixing it on, and the resin squishes right out, and then we will put the next one on. Push it right in. Look how beautiful that's becoming. Tap it out, and the resinous material squishes right out. It's almost like, an Oreo cookie. And you got the porcelain on one side, tooth on the other, with the resinous material in between, and now I'm putting another one on. See? Putting them on, and you see the material squishing out. I tap it right into place. There it goes. Ah, it's great, and he's thrilled. Now look at the next one going right on. Squish. All the material comes right out, and just put the porcelain right on. Here's the next one going right on, and there's the last one going right on. Now we've got to make it stay on so that it's fixed, so that it doesn't come out. We clean up all the excess resin. Now we're shining that laser-like light right on the surface of the tooth, and there it goes. Now, here's what he looked like before we started, because I know you forgot what he looked like. So let's see what it looked like. See the white spots? You see the edges of the teeth, and some teeth are much shorter than the other. Some are twisted and turned. He didn't like that. Now, after treatment, let's check him out and see. There you go. He is thrilled and happy. Look at that smile. Handsome devil. And he's thrilled. He's happy. It came out great. And that's today how people can have a smile makeover, the smile of their dreams, done effortlessly, easily, benign, simply, with what? With great technology. Great technology. So what we're talking about today is that great dentistry can be accomplished when rapport, relationship is set up between the dentist and the patient, and then we back up that good rapport and that good trust. Remember, BLT equals respect. We back up that trust with advanced technology. The advanced technology that we've got today, let's discuss that. We've got the ability to give injections today with computers. That's right, you didn't hear wrong, with computers. You can get injections today with a computer that drips the Novocaine in the mouth in a simple fashion so that it doesn't hurt. It is unusual for someone to feel anything with the technique. It's rare. Most people feel nothing with this because the computer today can adjust the dripping of the Novocaine into the mouth so that it feels comfortable, simple, and easy. Works absolutely terrific. Another way in which it can be done, with great technology, is the kind of drills that we use. The old-fashioned drills, I'm not talking about the real old-fashioned ones with the rope going around on the pulley and the crane, forget that. Talking about what I call old-fashioned would be the air-driven ones. Those air-driven ones give you that noise. Zzz. Everybody hates that sound. Everybody cringes when they hear that sound. Today, we use electric dental drills. It's quieter, smoother. The noise that you hear is basically a gentle hum because there's no air-driven sound. It's wonderful, and there's no wobble. It's just stable and clean and neat. Patients say to me, this feels so easy when you use it. Simple and comfortable to use. The technology is just amazing, all the different things that we have. And it continues. It continues. We have ways of, even if you want, giving you, if necessary, laughing gas. Laughing gas is great. We also have the patients listen to fabulous music, terrific music. So this way we have surround sound today in dental offices. You have surround sound, you have headphones, you have flat screen television so that you can watch DVDs while you're having the dentistry done. You can also have your teeth whitened, bleached today, simply, easily done in such a shorter time period than used to be done years ago. Dentistry has advanced in such a tremendous manner that people are being able to be happy with themselves, get a great smile, be happy when they smile, look good, and feel good. It's a whole new world. It's a terrific world. But let me tell you what has not changed. It's so important that you understand this. Here's what hasn't changed, and I took a deep breath because dentists say this till we're blue in the face. If you don't do the basic things, and get ready, you've heard it a million times, if you don't floss your teeth, it'd be great if you could do this after every meal, but let's face it, you're not. Once a day. If you don't floss once a day to get all the particles out, and if you don't brush your teeth twice a day to get everything off the surface, then you're going to be in big trouble. Why are you going to be in big trouble? You're going to love this one. What always lives in your mouth? What always lives in your mouth is bacteria. Bacteria is always there. And that bacteria, they got to eat too. You know, they're not stupid. They're living things. And if you eat and you let the food stay on your teeth and you don't brush it off, and that food stays between the teeth, the bacteria, they swim through the saliva and they look for the food. They find it and they eat it. Now, I'm sorry to tell you this, but after eating the food, what do all living things do after they eat and they digest? That's right, my cameraman's looking away. He can't believe this. They go to the bathroom. That's right, they give off waste. The bacteria do that too, and they give off the waste in your mouth. That's how you get a cavity. It comes out in the form of acid. So the bacteria are squirting out acid. They go to the same place in your mouth to get the food all the time because that's where they know the food is, and they eat the food and they squirt out acid. And that acid gets on your teeth and forms a cavity, or if it gets under your gum, you get gum disease, periodontal disease. And you don't want that. All because you didn't floss and you didn't brush. You do it. It's simple. Get yourself one of those irrigational devices, like a water pick, for example. It's important that you use that. Shoot it across the teeth. That'll wash away all the food and all the debris that's there. So now, if you keep your mouth clean, and if you brush them properly, and you get a checkup. Now, we used to be told that you should go in 2 times a year, every 6 months. Periodontal science has now shown that after you get a good cleaning, the bacterial count that's in your mouth drops down. You'll never get rid of the bacteria, but it drops down. And after it drops down, it takes the bacteria about another 72 to 90 days for the bacteria to regroup and rebuild their colonies. So if the cleaning knocks down their condominiums, their high-rises, their roads, their towns, then they got no place to go. The stragglers that are left behind, they start rebuilding, putting it back together again, stone on top of stone, so to speak, to build their homes and their highways. It takes them about 72 to 90 days to do that. So if you don't get another cleaning within the next 90 days, use the outside, from the time that you had that first cleaning, and then you wait another 90 days, now the bacteria are already eating and enjoying and squirting acid throughout your mouth and making things difficult for you. So, my opinion, you should be getting that cleaning in every 3 months. So now I'm showing you how basic things never, ever change. You've got to take care of your mouth. If I give you a brand new, beautiful $200,000 car, what are you going to do with it? You're not going to wash it? You're not going to wax it up? You're not going to tune it up? You're not going to make sure that the car is vacuumed and cleaned? That $200,000 car will turn into a dumpster if you don't take care of it. And your mouth is the exact same thing. So it's essential that we take care of ourselves. So now let's backtrack for a moment. What did we learn today? We have learned that you can have the fear in going to the dentist removed today. We now have, I can't say that's technologically advanced, I'll say that dentistry today is now psychologically advanced to be able to work with you, to help you in the behavioral aspect in going to the dentist. So what do we have? We have dentists now who are more attuned to the psychology of patient behavior to work with you and to help you. We have technology today which makes the dental visit, suffering is a thing of the past. It makes it today as easy as could be. I was going to say easy as pie, then pie stays in your teeth, then you get a cavity. We're not going to say that. But it makes it so easy today that you can have the dentistry of your dreams. From the extreme, which is the smile makeover, to maybe just a filling or even a cleaning. And now you understand the importance of taking care of your teeth, making sure that you brush your teeth twice a day, flossing at least once, maybe using some irrigational device like a water pick to squirt across the teeth and to clean out all the debris. I get patients who tell me, Doc, I got bad breath. What can I do about it? I said, it's real easy. You follow this simple procedure and you're going to be in great shape. You floss and you brush. You use the water pick device to get everything cleaned out. If you do all of that, you'll be in great shape. There are other things you can do with baking soda and peroxide, but that'll be for another show. I'm not going to explain that now, because then if I tell you the wrong thing and you don't do it right, you'll get in trouble. So you've got to understand that you must go to your dentist to get your mouths checked up. Don't go when you got a problem. Go before you got a problem. It's so much easier for you. You don't want to, if the horse is going to run out of the corral, it's better to close the gate before the horse runs away than earlier. This is very simple and very easy for you to do. So many more things that dentistry offers you today besides a great smile makeover. Fillings today, you've always had your choice of using mercury fillings. Now that's a big debate. And, you know, there's a lot of people on different sides of the aisle here saying that you can use mercury fillings. We call them silver fillings, mercury fillings, because there is a lot of mercury within the filling. So some people call them mercury fillings. There's some countries today that have banned it. There are a lot of dentists that refuse to put it in the mouth because of their own personal feelings. Me, I personally believe that I don't want to use that stuff in the mouth. I just use bonding materials. Bonded material is great material to put in the teeth. It's simple to use, it's complementary to the teeth, and it works really well. And there are lots of dentists who use that. So when you go to your dentist, ask about a choice between having a bonded filling placed and a metal filling placed. There are a lot of different reasons, and your dentist can explain that to you so you could see what makes sense for you. But you've got to know what choices exist. You see, I see myself as an advocate, as a dental advocate, not just to fix your teeth, but also to advise, to explain. And that's what the purpose of this show is all about, to let you know what exists out there. You know, your dentist wants to help you. Speak to your dentist about it. Ask your dentist what options are available, what can be done to help you in various ways. The options that are out there are so broad and so varied. Ask about when you get your injection, how you can get your injection. Ask if using laughing gas is good for you. You don't go to sleep with that. It kind of just makes you feel kind of good and makes the visit go by pretty quickly and pretty easily. So discuss these things with your dentist, because that's what your dentist is there for. And also build up a good relationship with your hygienist. Your hygienist is there to help you, and your hygienist can also advise you on your diet, on good home care, and what can be done so that you keep your teeth for a lifetime. It's essential for you to do this. You know, I've spent so many of my shows doing all the things on Long Island, food and wine, and interesting people we have here on Long Island. But we've got a lot of great dentists here on Long Island, and I wanted also to take some time to talk about this. So I'm going to leave you with one goofy kind of phrase, but you know what? It works. Be true to your teeth, or they'll be false to you. I know you rolled your eyes up on that one. Or better yet, floss only those teeth that you want to keep. Think about that for a moment. So I'm going to bid you adieu right now and just tell you, just take care of your teeth. And you got lots of people here on Long Island that can help you, and you see that there's great technology to do the job perfectly for you. So, as I always say, Dr. Pass is saying, so long for now, and next time we see you, we'll do other things on Long Island other than be down in the mouth. So right now, I tell you, take care, and whatever you do, do it with passion. So long.